I mean, it's always good to be very versatile, and more especially when you are versatile and you are already a professional, then it means that you really know what you are doing.
Thank you.
So we compliment your work, and we think many other Africans who are very dynamic like you must do something as well, and not to just be just very parochial in one area and then just focus on in that area. But I believe that having varieties are very, very good.
I believe so as well.
Now tell us, our listeners, how the vision began, which led to RAYBEN Diagnostic Laboratories.
Yes, once again, my name is Acheampong, as you said. I've been living here in Holland for the past 27 years, done accountancy. The vision of RAYBEN Diagnostics as such began in 2002. I've always had the dream, as I said, to do something in Africa. Okay. It came to pass that one of my close family relatives got sick in Ghana and needed diagnostics assistance for the doctors to be able to help her. And it came to notice that the majority of diagnosis was supposed to be sent to South Africa.
Oh.
And before the results will come back, we'll be looking at 2 weeks
and
beyond. So I look into my brother, who is actually the medical laborant. I've been working at the FUMC and Arts and Laboratory in Amsterdam. I said, this can be possible.
Yes.
We are living here in Holland and we have all these attributes and all this information to our hands.
Yes.
How come now our family member is having this health issue and we can't help? So that was where the idea was born, and I believe when an idea is born, a step is also taken. So we started asking around. Unfortunately enough, he was having a courses with somebody working at Abbott Diagnostics, Mr. Mark Meinfeld. So we had a slight discussion with him that how can they help us establish a medical laboratory in Ghana for the sake of our people. So we decided that what we need to do is we need to seek for old machines which are still working. You see, that was what the idea came from. You see, we are living here in Holland where so many things have been thrown away or have been broken, whilst they are not broken, in fact.
Okay.
So that was where the idea came from. So how can we find organizations, institutions, hospitals, companies who are having products, machines which are still in use, but they are not using it anymore because there is a new system on the market.
Exactly.
So that was where the idea got born. And from there, together with Mark Meinfeld from Abbott, we started having information, and we eventually came to the Academic Medical Hospital, the AMC, which is in Amsterdam Southeast, in the person of Professor Sturck, whom we also sold this idea to. And he told us, but I have so many people coming to my office saying we want to build a medical laboratory in Africa, in Ghana, Nigeria, South America, but none have ever succeeded. So welcome with your idea. But so we said, okay. Now, so we left and we came back 4 years later. We had established our own building.
Awesome.
And in that we came across a lot of companies like the FU Hospital, like the SKR people, who gave us tables. So that was where the idea was born.
Yes. And
as of now, today, I can proudly say we have a big facility, an European standard, an Holland standard, as I always say, in Ghana, in Kumasi.
In Kumasi.
Which is a 3-story building, 4 facilities of medical laboratory diagnosis, plus a research center, which we have now established as of now.
Awesome. So would you say you really encountered challenges in realizing this beautiful dream?
Oh yes. It's all about, as I said, having the faith. It's hard work.
Yes.
And I believe if you have the faith that something will happen, you work towards it.
Yes.
And imagine, as I said, the idea was born in 2002, and we are now living in 2014. So we are discussing a 12-year track, and I believe not anybody will wait 12 years for something to happen. And we established a lot of things. I mean, even in the winter, going to organizations.
Yes.
We have driven from Amsterdam to Friesland, Groningen to Zeeland to pick up stuff.
Yes.
It's just in the winter. I quite remember in 2010 we got some stuff from from the AMC.
Awesome.
And it was around this time, and it was really snowing.
Yes.
And imagine me, my brother and I being an accountant, as I said, I don't need this, but standing in the winter, picking up all these products to make sure that it will once again be in Ghana for us to be used. So it was a lot of hard work, a lot of energy. And imagine having all this stuff in Ghana, at the port, and making sure that this stuff will be out of the port.
Yes.
In cars from Accra to Kumasi.
It wasn't an easy task.
It's not an easy task, but as I said, it was a fun run. It's fun. It's fun doing things that you believe in. It's fun knowing that eventually, as one.
So why did you choose to do it by yourself? Because see, I believe there could have been some people also that had such dreams, and then they looked at all the implementation, all the cost of implementation and the job involved, and somehow they deserted the whole vision. And sometimes you see them giving it over to maybe those there to run, you know. But here we see you choosing to do it by yourself, you and your brothers.
Yes, I believe, you see, I say if you live in Holland, I'm fortunate. Once again, I was born in Ghana.
Yes.
And brought by my family, by my mom and my dad to Holland.
Okay.
I see myself as being blessed.
Yes.
With opportunities given to me here in Holland. And as I said, I've always have this drive in me that I want to share my knowledge. I was in just a bypass. I was even the former youth chairman of Sikaman, a Ghanaian organization.
Okay.
Trying to help the community. I've always been trying to do something. I was seeking, back in the days, going to the European Union, seeking for funds for people in Southeast who don't have money to go on vacation. I've always been trying to help.
Yes.
Because I believe I have a certain knowledge that I need to give on to somebody. Yes. Even though I have my kids. And somebody has some knowledge who they can pass on to my kids as well.
Yes.
So I believe together we can always achieve more than a single person.
It's true.
If I'm supposed to leave this, eventually it is now settled. I can say I'm an accountant, I earn my money, I drive my car in Amsterdam, I have my family, and I don't need, why the force? Why do I need to go to Africa to disturb myself?
Exactly, that's the mentality of many people.
Yes, it doesn't stop there. The issue is, I believe if you now go to Kumasi and you ask the workers there, they will all confess that they have never been to Holland before, but they have the feeling that they work based on the Dutch mentality, based on the Dutch quality. So if I don't go there, I can never transfer the knowledge that I've acquired, or we have acquired here in Holland. What we do is, as I said, the whole project, we have never asked for fund. We are now in a situation that we need some small funds to move on and stuff further. Yes. What we have always seek for is, we have never seek for fund from any organization. What we have always seek for from the AMC, from the few, whoever, we have seek for knowledge. We want them to transfer their knowledge that they have acquired here. I believe you all agree with me that the standard of education here is way beyond what we have in Africa. Exactly. So if I'm supposed to ask for only money, I mean, you won't. If I need food, I don't want you to give me food. I want you to teach me how to fish. Exactly. So what we do is we have asked them to give us their knowledge, to try and come with us to Ghana, which is often happening. Yes. I mean, AMC, Professor Stoic, the labs, they are going back and forth to Ghana. Okay. I mean, about diagnostics, the people at Abbott coming to Ghana often, installing machines, training the people locally. We also have the opportunity from here for us to bring twice a year people from Ghana, but not only from Ghana. As I'm talking about Ghana now, we have started from Ghana. Yeah, it's going to spread. Those people who know RAYBEN Diagnostic, if you go on the website, we are discussing not only Ghana, but we are discussing, as you said, our neighbouring countries. Yes. So you take a step from Ghana, and from there we move on. So I'm asking anybody from other African countries, either Nigeria, Togo, Ivory Coast, whoever is listening to the voice of Naija as of now, please give us a call to this radio station, and we always, via Reverend Ellen and Reverend Larry, can always have a discussion and see how best we can also help other countries as well. Exactly, it's going to spread. Amen. It will surely spread to the other African countries, because this is transforming lives. Yes. And as it has begun in Ghana, Ghana is not going to be just the end. It's going to spread to the other African countries. Amen for that. We are very, very happy, and we're going to give it a push. So can you explain to our listeners how RAYBEN Diagnostic actually works in Ghana?
right now?
RAYBEN Diagnostics is actually, as I'm speaking now, the only medical laboratory in Ghana who is running 24/7 service.
Only?
Only.
Repeat.
The only private medical laboratory center in Ghana. Check, and whoever says it's not true, please call Reverend Ellen and Lally and confirm. We are the only running 24/7 laboratory medicine in Ghana. You can even go to the big...
We need to applaud. My God, this is awesome. 24/7.
24/7, meaning we have two, but we work physically from 7 a.m. till 3. We have two shifts, 7 to 3 p.m. and from 3 p.m. to 10:30 p.m. Now, after that time, we are on call duty. Now, the reason that we are there.
Yes.
Is that because the doctors are not used to having a laboratory system working 24/7.
It's true.
So we were there throughout the night, but nobody was attending to the services. So what we have said, okay, you give us a call at 1 a.m., we are at your service. Within 15 minutes, we'll make sure somebody is at the doorstep to assist you.
Yes.
So we are running, Saturdays and Sundays we are running. You will go to the big hospitals and the laboratory will be closed. You go to the local clinics, laboratory will be closed.
Exactly, I know.
So I believe people who are living, who are from, as they are listening, who are from Ghana, from Africa, I believe what is going on in Ghana is not something unique. It's also going on in Nigeria or also going on in Africa.
Yes, yes.
So we are running, like I said, it's a product from Holland. We are used to in Holland that a laboratory system is run 24/7.
Yes.
So if we are from Holland, we are running 24/7.
So what Accountant Ray is saying here is that those of you who have family members in Africa, especially Ghana, where this laboratory is on, please don't hesitate anymore to make reference. Give us the telephone number of Ray Laboratories so that in case they want to send their loved ones to your laboratory, please can you just mention the number and how they can contact you via email and all of those channels, please.
If you want to contact the main office in Kumasi, the office telephone number is, if you are in Kumasi and you are given a call, or let me say the fully, it's 0233 3220 81220. That is if you are from Holland and you want to make a phone call to Ghana.
Repeat again, please.
0233 3220 81220. And if you want to, as I said, I am the financial director of this RAYBEN Diagnostics, and my brother Ben is a laboratory. If you want his direct phone number, his mobile number.
Yeah.
His direct number is 0233 262 267 861. I will repeat, 0233 262 267 861. And you can always reach us via the email on info@raybendiagnostics.com. And if there's any further information, we have the website running now, but it's being updated. You can visit on www.raybendiagnostics.com. And I am now in Holland. If there's any information that you want to ask me, obviously my phone is always on in Ghana, so my cell phone, my phone number 0650 441 639. I repeat, 0650 441 639. And my personal email address is ray@raybendiagnostics.com.
Yes, a lot have been given to us. Just make use of what you think you can really have. At least Ray, the accountant Ray, is here, right in the studio. So maybe if we finish the broadcast and you really need to contact him for your loved ones or for yourself, because I believe right here he is in Holland, you can make use of the privilege that he is here, and then go to him and then make contact with him. His number is 0650 441 639. And don't forget, he can speak Chui. So no matter the level of your sickness, please take somebody along or go and speak to him. He will understand. Those of you who are from the other parts of Africa, he speaks English fluently. So, also those of you who are Dutch and you are listening, maybe your husband is a Ghanaian or you have in-laws who are Ghanaians or Nigerians or Togolese or Cameroonians or whatever, and you feel like they need more attention, you know, on this sort of health issue, somebody who can diagnose them and give them the exact information, give doctors the exact information of what is their sicknesses, please contact Accountant Ray on 0650441639 here in Holland. But should you want to give the number to those in Africa, don't forget it's 0233-3220-81220. And for your information, we are going to continue repeating this number, and from time to time as well. If you go to Radio Voice of Naija website, those of you who are fans of us, you will also see their contact, because we're gonna paste this contact there. Then you can also pick it from there. Okay? So you've not missed anything yet. We will surely make information available to you as for how you can reach Ray Diagnostic Laboratories.
Yes.
Thank you so much. So, how are you dealing or coping with the cost of living differences between Holland and Ghana? Because I know that, you know, it's very, I mean, to run a laboratory and to be able to get those good laboratories are very expensive.
Yes.
For instance, in Nigeria, very, very expensive. So, how do you cope up?
It's quite a huge service, and I believe. But the most important thing that we are doing is we are trying to give information for prevention. Yeah. If you see our slogan, our slogan says we teach. We believe that prevention is better than cure, but we also teach that prevention is cheaper than cure.
Yes.
What we have as we start running operation in November last year. We are a year now. We see that many of the diseases, and we have so many infectious diseases in Ghana. Let me talk about, because that's why I'm here now.
Yes.
Many of the diseases we can prevent. The way we live, our hygienic area, our situation. So we don't only sit in the lab, but we go to villages, we go to churches to give information how people can prevent diseases like malaria. I mean, you can prevent it just by being hygienic.
Yes.
See, that is those things that we do. The cost of laboratory medicine in Africa is very expensive, because, as we say, it's like a monopoly market, as we say.
Wow. Because
the best there are very soon. But what you also see is people tend to take off a price in Africa than of a quality.
Yes.
You see, we often go for quantity than for quality.
Yeah, that is the way.
And that is something, that is also a perception that we need to change. You see, something has a cost, whether you like it or not. I mean, to even have a transport, it has a cost.
Yeah.
So you need to pay. So we are trying to make the cost as minimal as possible, but it still has a cost.
Yeah.
You can't say I'm going to Ghana or Nigeria and do laboratory medicine for free.
No.
You can't sustain it.
No.
So we are trying to minimize the cost as much as possible in discussion with those people who send us the machines, those people who give us the reagents to run the system.
Yes.
But all things being equal, the quality for us is number one.
Yes.
So you come to RAYBEN Diagnostics, and what we have seen is we have the best quality, the best service, but we are even sometimes cheaper than the local laboratories.
Yeah, because your passion is there.
Yes. And the thing is, I hope I'm wrong, and I really hope I'm. We think that we don't deserve good things, especially what I've seen in Ghana. They will come and they will see the facility and they're like, I'm afraid to walk in because it might be too expensive. Oh, perception.
Yes.
Perception.
Yes.
And really, that is something I'm saying it out of first-hand information.
Say it.
Because you'll be sitting there and people walking like, I was afraid to walk in because I thought I couldn't afford.
My God.
You see, the perception is because laboratory medicine is done behind closed doors.
Yes, exactly.
And nobody knows what goes in that closed door. So, why would you put such a facility down for only medical? That's what they say, for only medical laboratory.
Yes.
And I say, but why not?
But that is real life.
Yes.
Hey.
And the question is, so why not hospital? I said, you are all building hospitals, but you don't know what to treat.
Yes.
You don't know the diagnosis. You don't know what somebody's having. You are giving medicine.
Yes.
Without knowing what the person actually has.
This, exactly.
So we need to try to change us living in Holland who are used to these best facilities that we're used to. That's why I'm also on the radio. Tell your people back home.
Tell them.
You deserve also the best.
The best. Exactly.
So if something is the best, don't be afraid. Walk in, seek information. If you can't afford, you can't afford. But have the nerve, have the dare to walk in and just ask, what are you doing here? Just a question, simple question. Please, I was just walking by your building. I saw your building. I like your building. But what are you actually doing there? You see, we need to help them erase this fear of not really, we also deserve the best. So that is something that we need to do. So what I'm saying is, we are trying to give them the best possible laboratory medicine that we can afford.
Yes.
That is one. Two, what we're also doing is, because we have data, I can sit here and confirm that we have data.
Yes.
You go to many...
And in Africa, we don't have data.
Yes.
That's the problem.
That's the problem. You go to many clinics, many hospitals, majority of the labs, and they will not have your results that you had 3 months ago.
Wow.
Hey!
They won't. They don't have it.
And sometimes, accountant, sometimes, you know, they will take another person's data and give to you.
That is for sure.
That means giving you another person's sickness and treating you on another person's medicine. Do you see how many lives can be lost through that?
And there's so many information that we can share what we have seen this past year. Even the way they take sample, the way they draw your blood.
Yes.
As we have seen. What you are used to here in Holland, they are still doing the old system.
The old system.
And once again, RAYBEN Diagnostics is not only saying RAYBEN Diagnostics is the best. No, we also want to, because even if you say we will remove all the medical laboratories in Ghana, we RAYBEN Diagnostics, we can never treat everybody.
No.
It's not possible. So what you need to do is, you also need to educate the existing laboratories as well, to raise their levels up, so that they will also assist people on the problem.
Yeah, but the fact is that they do not have the sort of sophisticated equipment you have.
That is true.
Because you're opportune to be brought up here,
yes.
and then you've met all of these professors, and then you are working together with them. But those of them, they are still struggling.
That is true.
So how would they now raise their standards
you see,
when they do not have
from,
the appropriate machines?
Let's start from the most simple thing. How do you redraw blood? So if you think, okay, a certain test I can run, that is what we are trying to do, but we need to start from the floor.
Yes.
How do you draw blood? How do you save the patient samples? How do you do registration? You see, this is something that you don't need a lot of sophisticated machine to do.
Okay.
So we need to start from there. Let's just start from, then we tell them, listen, this is what you can do based on the machines that you have. Try to do it and do it the best way.
Exactly.
So that is what we are trying to do. Just showing them, giving them our information.
Yes.
You see, this is something that is not done in Ghana.
It's true.
You see, we are sharing information and like, why are you doing this? You are competitors. Yeah, it's true. What we are used to here in Holland, if something new comes out on the market and you are on the same field as being an accountant, you go to seminars.
Yeah, it's true.
Go to and you share.
You share.
Information is being shared.
Yes. But in Africa, it's not that way.
You use it to be strong. You get me? You use it. So this is, we are using RAYBEN Diagnostics as a footstone, as a product of Holland.
RAYBEN, I'm so proud of you people.
Thank you.
Very brave. And it's because you are sure of what you are doing.
Yes.
You see, the reason why people don't like to share has to do with, borrow me the language, please, insecurity. When people are insecure, they will not like to share. So what you are doing in that field right now is to let the other medical officers know that this is the way it has to be.
Yes.
So it doesn't have to be at the closed doors anyway. So if you're out there and you are listening to this broadcast and you feel like making contacts right now with RAYBEN, he is in the studio of Radio Voice of Naija on radio. Please give us a call on 027371619. Perhaps you have a question to ask him, or there's something confusing you. Even if you cannot speak English, you want to speak in Twi. Go on. He can understand you very, very well. So, you made mention of infectious diseases. That seem to be like the commonest aspect of the diseases that are common in Africa. Can you, for the sake of a layman who is listening to us right now, can you expand on that?
Yes.
By telling us one by one. Maybe if it's dysentery, you say, okay, these are the, you know what I mean?
Yeah.
If it is cholera, you say, okay, it is this. So for those who are listening to us.
I believe for the Ghanaians who are listening, we all learned of the outbreak, as Reverend Ellen just said, the outbreak of cholera in Accra.
And Ebola also.
Ebola. Fortunately, in Ghana, we haven't had Ebola.
Yes, it's true.
I will try to emphasize on two diseases. We in Kumasi, the Kumasi metropolitan area, people can say the Gemeente Amsterdam, we are ordained to screen people who sell food vendors. Like in Nigeria, you will see people selling food on the street. If you sell food on the street or you produce water, you do anything concerning those things, you need to get a certificate in Ghana for you to be able to do certain things.
Okay.
We are ordained in the Kumasi Metropolitan as one of the laboratories, if not the only laboratory, to do such screening.
Oh, really?
Yes. We have a certificate for it. So what we have seen is we screen them on hepatitis B and typhoid. These are the two things that the community have said you need to be screened on. Why did they say that? Because these are diseases that can easily transmitted via contact.
Oh.
If via sweat, you don't sorry to say, you don't need a sexual interaction to get typhoid and hepatitis B. So because of that, if somebody has hepatitis B and they are cooking for you, the chance that they can transmit this disease to you is very high.
You know, they have this mentality as well that once something has been cooked, then the germs die. But it's not that. There are some of these bacteria that come alive.
Yes. Now, imagine you have a plate. The food is being served on the plate. The plate that they use is the person might be sweating.
Yeah. Jesus.
So you see, as I said, I'm accountant. When I got into this, I was in Ghana. I was like reluctant to eat on the street because of the information that you get. But yet you would. And what we have seen is approximately for the people that we have been screening for the past year, approximately 12%. I'm not saying this information to scare people, because it's something that you can easily help.
Yes.
So you need to share the information.
It's important.
Approximately 12% of these people that we have been screening has hepatitis B.
Hey!
Which is a lot.
I can't don't go there. No, really?
Yeah, which is a lot. But you see, the issue is they don't know. But the problem is, once again, I want somebody in the medical field to help me, because I'm not in the medical field too. Yeah. So that we can use this information to help each other. The reason is people are scared of this. But the majority of that's why I was saying prevention. You can easily prevent hepatitis B by having your vaccinations. Do you get it? Yes. And it is cheaper. I mean, in Ghana, to get hepatitis B, you need 3 times of shots. It will cost you approximately 120 cedis. Which is, yes. And you have your vaccination for 10-15 years.
Wow,
that's good. Here, like if you want to live to Nigeria, you need to go to the tropical.
Yes.
You also get hepatitis B vaccination.
Yeah, but it's more expensive here.
Yeah, but you get more. You get not only hepatitis B.
Yeah, you get all of this. Yeah.
Imagine, you understand, but you have to. You will still need to have it before you go. Yeah. Because it's something preventive.
It's true.
If you don't prevent it and you get it, it will cost you like you'll be going on 2 years doing hepatitis B screening, hepatitis B viral test.
Then don't you think it's very necessary that everyone in Africa must have that?
Yes.
I mean, to prevent this side food, the way they jump into this side food consumption is alarming. Everywhere you see these side food sellers, and then with the mosquitoes and with the flies, and some of them, they even sit on top of dirty gutters. You know what I mean?
I believe this.
So they are really carriers of this.
This information, I don't think it's only in Ghana.
No, everywhere. I'm talking about Africa, because you can carry this as a campaign, present this to the governmental sector, so that our president let them know. Because I believe prevention is better than cures.
And we have all this data. That's because we have a server something there, because we want to use this facility to help. We don't, you see, obviously you can prevent as much as you can, but once again, while aging, some sickness comes, that's why you can't do anything about it. You need a proper diagnostic center to be able to diagnose, for the doctor to be able to help. But many sickness we can prevent, and via getting all these data, now in Ghana, maybe next time in another country, we can use this data to help each other and say, listen, if somebody is seeking for fund, then use the fund to say, okay, we are going to do hepatitis B screening.
Yes, exactly.
For this city. And so this is what
That's
we are. This is something that we are trying to do. And so, like I said, this information is there. There are so many fields in laboratory medicine which we are trying to do, but we can't do alone. Even if you go to the academic hospital, AMC, there are so many departments of lab. So what we are trying to do is we want to do one thing and do it best. What we can do, we liaise with Holland.
Yes.
We liaise it through Erasmus.
Yeah.
AMC. So that whenever something is there that we can do, we call them and they assist us. So we take the sample, we use it via DHL, 3 days. The next day is here in Holland, and they do the diagnosis. And in maximum 5 days, you have the results back in Ghana. So instead of waiting,
this is beautiful.
2 weeks, 1 month, you have in 5 days we can report.
Because this is beautiful.
There are certain things that we just can do based on either the investment factor, which is machinery, which costing a lot of money.
Yeah.
But the most important thing as well is the knowledge. You can have a machine, but if you don't have somebody to use a machine, I mean, there's no need for you to have the machine. So, because we have all this network, which we have now in place after 12 years of work, 12 years of running, we believe we have the access, and we hope, if there are not only people in Ghana but other people from Holland, as I said, we use machines which are still working.
Yeah.
To give it a second life. That's what we are asking for. We are asking for this from you. We are not asking for money. We are asking for your knowledge, for you to go with us to Ghana, to Nigeria, to Ivory Coast, to Togo, to educate our people, to show them that there is something other.
So what you are asking, RAYBEN, can I understand clearly? Are you saying that the sponsors,
yes,
what you need from them would be the machines, or
we are not only machines, tables, computers that you are really.
Say it loud so we can know the things.
What we are asking for, because we are having machines in Ghana, which we have a couple of them which are brand new.
Yes.
But the majority are not new. They are used machines here, which can run for the next coming 5 years.
Yes, even laptops as well.
Everything. If you have it at your office, which you're going to reinvest in new systems, and you don't have the need for these old ones anymore, we can give it a second life and really actually use it.
Tables, you say?
Tables, everything. Because as I said, we receive a system from SGR in Schiphol. They removed some of the tables from some offices at Schiphol, and they gave it to us.
Yeah.
You come to offices in Ghana, they are standing there. We are using them. And the only thing we invested is we invested in the transport.
Yeah.
We paid for the transport, we paid for the shipment, we paid for everything. We use our own money to do it. So we are not. But there are some systems that we need to invest in. We need to invest into a solar system.
Solar system.
So if there's anybody into a solar system who wants to assist us, help us. But what I'm actually saying is, we throw a lot of things away here in Holland.
Yes, it's true.
We throw them away.
Yes.
And for sometimes there are some businesses
because we don't know what to do with those things.
They pay for throwing them away. You get me?
Yes, I do.
They
have to pay for throwing them. Exactly.
So we are here, and once again, you call Voice of Naija, you call Reverend Ellen, you call Larry. If there's anything, you leave your information behind, and I believe we can
get it.
Via this, we can use it and do a better work. Once again, the idea is quality laboratory medicine.
Exactly.
And from there, help to bring patients to the proper hospitals. So that's what we do, because it's, sorry to read my voice, it's a bit of a jungle to go to the health system care, if you don't know where you need to go. So people living here in Holland, the Ghanaians living here, if you have a family member in Ghana, sometimes they are afraid to send money back home to help people, because they think the money will not be used for the proper source that they need to be used for. So
even you know one thing I can't Ben, Ray, I think as time goes on, let God help you. You expand in all sides, so that those of them who have the family members down there and they want to send them to your clinic, to the Ray Diagnostics, they can even do the money transfer.
that is what you're
They can do the money transfer to you. They're sending it because of what you just said. That some of them are afraid they may go and take that money and drink patashi. Is it patashi? They can drink patashi and at the same time they are sick. So, but they can remit the money through Western Union straight to your account, and then Immediately you see it, now let their people.
Because what is so important is we want to bring the medical health together. You see, there is information. You have one clinic here, one there. There's no information shared.
Yeah.
Here in Holland, if you go to hospital, they will find your information from that hospital.
Everywhere.
So we try to use our network to bring people together. So if you come to our office, immediately you see one thing that we have seen is somebody might have some sickness because they have heard of RAYBEN Diagnostics on the radio, on the TV. You will see them coming to our office. Immediately you come to RAYBEN Diagnostics in Ghana, and you tell me you have a headache. We will not do your lab for you there. We will make sure we get you a doctor to diagnose you. That is something that is not done there. Because they will see it as a revenue. You will come to you go to a lab and you say, oh, I want to do this lab test. See, they will not ask you questions.
Yeah, they just
like
make
why?
money. Oh, yes, I know.
You understand? Like why? You see, the question is coming to a lab. Why are you coming to a lab? See, some people, as we are saying prevention, we tell people like from 35, 40 and men to do a prostate check.
Yes.
That is prevention. You can, oh, I'm 40, I'm a male, I just want to do PSA.
Yeah.
Then we will do it for you because you are this. And when the results come out, we have somebody there who will sit with you down and explain things to you.
Yeah.
But when you tell us you are sick, it means we are not doctors.
Yes.
So we are not going to sit down with you and treat you.
Okay.
We will direct you to a doctor. And that is something that people are now starting to say, hey, that is a different level.
It is.
So we will send them to, sometimes we even drive them ourselves to the hospital and hand them over to the doctor. Like this patient has this problem. If you need a certain laboratory test, sometimes they will give us a call back, like I have these symptoms. Do you have an idea what kind of test we can also add? You see, this is interaction that is not happening today in Ghana.
Yes.
Which is
you are breaking that,
that
tightness and secretiveness.
Yes. So that's what we are trying to do, just to make it open so that there is, because if I'm sick, I want a full service, health service. So I want the doctor to be able to discuss it with the medical laboratory why a test is needed or not. So that is the idea.
Let me ask you one quick. Okay, let me just ask this question first. Right now you are here, Accountant Ray. Is it possible that those who are listening to us and they have their folks down there, but they will want that they go through screening right now? Is there somebody down there that they can meet you and do their payment while you effect service over there?
The business is running. We are building an institute, and it's not Ray Institute, it's RAYBEN Diagnostics. So the institute today is going on. If somebody wants to call the numbers I gave them, they don't need to call me. They can call Ghana.
Do you also have intention of at least having one as well in Accra? Because there are people who are in Kumasi or in Accra who don't want to go to Kumasi.
Yes, I believe if you go to on the website, we as I said, we are not even only looking to Ghana.
Yes, I know.
So Accra, if God willing,
yes,
in the very, very near future, not only Accra, which is the south, but also to the north, Bolgatanga. We also want to open up.
All right, yes, somebody wants to ask a question.
Well, actually, my question is related to what you had just asked about people living in Accra. The lab is in Kumasi, right?
Yes.
Is there any way somebody is in Accra who desperately needs diagnostic treatment, if you like, isn't there a way to facilitate that so that that person can have maybe the sample, whatever taken, or whatever needs to be done, without the person necessarily having to travel down there to, for example, can we take the samples and send them to Kumasi, have them processed, and the results sent back? Is there a way to make kind of bridge the distance gap?
Yes, that even today, even now in the past, we have been doing samples from Bolgatanga, which is even far further from Accra.
Yeah.
What we do is there's flight going back and forth from Accra to Bolga, from Accra to Kumasi. So we have somebody there who can go to your house, as we said, the homebound patients. Yeah. We drive as far as 1 hour, 1.5 hours to go and take sample from a patient who can come to the lab. Today, I believe if people in Ghana also listen to voice, they can confess. So that's what we do. Because if you have, an elderly person, sometimes it takes too much. They'll not only them there, but their brother needs your assistant, an uncle needs your assistant. So what we normally say is, instead of you coming to us, we will use our motorbike to come to you. So as Reverend Larry, we do. If somebody is in Accra, in Bolga, you give us a call. and you make sure that there is somebody at your end to come and take the sample, and then make sure that it goes back to the end at the main. Even in Kumasi, we are not only at the main office in Kumasi. We have special depots where people can go and take sample, and we use the motorbike to take it to go to the main office.
Awesome.
Simple laboratory tests like sugar are done locally, because that is something that needs to be done first.
Yes.
And that is something that you can do by hand manually.
Yeah.
And that is, you need to go to the big machines.
Okay.
That is done locally. But the test that needs to be run through the big machines must come to the main office. So we are able to do settings for patients.
Awesome, awesome, awesome. So if you are listening to this broadcaster on better diagnostic solutions for Africa, RAYBEN Diagnostics are here, and the information that have been shared, I believe, is not just for those of us who are here. It's also for those who are out there, who are down in Ghana, who you think you value their life and you want to at least help them to live longer. Give a call right now on 027371619, and in case we are off air, please remember Ray's number is 0650441639, and in case you want to call to Ghana Direct, you can get Ben. His direct number is 0233262861. I repeat, 0233262861. That one is SOS. If immediately you call that number, Ben will pick it up, and then you call the one here 0650441639, and Ray will pick it up, and it becomes RAYBEN Diagnostics. Now we're gonna take a short break, and then I see you soon.
Yes.
Welcome to.
Thank you, madam.
Now we want to know a little bit about how you diagnose, how you take your treatment. Is it treatment or
Diagnose.
Do you diagnose that?
HIV.
I mean HIV.
We do diagnosis.
Do you do that?
We do HIV diagnosis. I want to say one thing about it. You see, there is a lot of HIV strips that they use to diagnose HIV. And not only HIV, but also the hepatitis B I was talking about.
Yeah.
We have seen that the hepatitis B strips that is used on the market in Ghana is not that effective as it is. So we are giving the teachings about it. But what we also do is when somebody has hepatitis B or HIV, there are a couple of tests that you need to do for the treatment.
What do you mean by HIV strips?
You see, when you go to the lab, you want to do HIV test.
Yeah.
They will tell you, they will take your blood and they will do the HIV test for you.
Okay.
And they use strips, that is like something in a paper or that they use. It doesn't go through the machine.
Okay.
It's a strip, they put it on it and then the results comes out.
Yes.
That is something that strips are not all of them. Let me be careful what I will say. That accurate is based on price. It means if a medical laboratory buy the cheapest HIV strips,
yeah, it
means that eventually they will be charging you less for the test, but the results
will be wrong.
It's a problem.
Hey.
Yeah, not reliable.
And the same goes for the hepatitis B. We have had a situation whereby somebody has had hepatitis B and was being treated. And the moment they were not fully recovered. But if you use the strips, they will tell you the person hepatitis B negative. Which is the person hasn't got hepatitis B.
Yes.
But the moment you use it to run through the machines that we are using, you will see the person is positive. There is a small line between sometimes positive or negative.
Then it's better to do that with a RAYBEN diagnosis.
So those are little things that we have been seeing. But eventually, using machine means somebody may have to pay a little more.
Yeah, exactly.
And you get, but once again, we go back to the fact that we in Africa, we are used to quantity instead of quality.
No, we don't need to emphasize on quantity now, because to some of the folks we are talking to, I believe they value their families down home. Yes. So instead of giving them that money or doing big funerals, I think it would be better
for that.
to prevent these funerals, isn't it?
It's good, much better. And what we also do is we will be the first. I think I can be sure to say, because I'm saying it because of the information that we have received from people who are selling these machines. Okay. From the Airbuds to the Siemens to the Sysmex. They have told us doing HIV biology, which is molecular biology medicine, laboratory medicine in Ghana, we will be the first in West Africa as doing it for diagnose for patients.
This is beautiful.
There are organizations like I can mention cases here who are doing research, but they are not doing a diagnosis for patients to get results. We will be, God willing, we have the machines that we need to start installing them. God willing, by the 1st of June, we should be running this lab, and we are inviting everybody. We also already have a letter from a Nigerian lady doctor who wants to come and do an internship there.
Yes.
We are inviting everybody.
Yes.
We are inviting everybody who wants to be partaker of this.
Yes.
Come, let's have a discussion. And if you want to live 6 months in Ghana to do it, if you're not from Ghana, you want to live there, you're welcome to do it. So we are running all these things in favor of our people.
Yes. Awesome. It is, and I believe that the blessings of God will be upon this. And somebody who is out there, sponsors who want to sponsor RAYBEN Diagnostics with any of the things that they need, ranging from laboratory equipment to tables, to used computers, laptops, iPads, and all of the solar system, solar energy system, and those things. If you are there and you really want to partake in this and be a blessing to humanity, please just contact RAYBEN Diagnostics. I'll give them a call on 00233 3220 81220, or send also email to info@raybendiagnostics.com.
Yes,
you can also go to their website in case, because I know there are some of you who are like Dalton Thomas. You want to see and then put your hand there before you know that what we are talking is true. Please go to the website of RAYBEN Diagnostics. It is www.raybendiagnostics.com.
Yes, ma'am.
Is that?
Yes, ma'am.
And you gave us your private...
my own is Ray@RAYBEN Diagnostics.
Ray@RAYBEN Diagnostics. I like that one too. This one you can miss some Ray@RAYBENDiagnostics.com.
Yes.
And then you will meet this gentleman who is so unassuming but highly loaded upstairs. Then they will tell you how they may be a blessing to you and your family. So, waiting with the talk, I won't round up. You say, the better life we they get here, our people down also can get them. They can get it.
They can get it.
Because we won't talk a bit broken, so that there are people who say we they speak too much English, maybe they no fit understand. You just speak. Just put one tree, let them know that...
for free Radio Naija, your friend Ray Acheampong. Mr. Ray accountant. So Matana Amsterdam Southeast 27 years. There could be a medical laboratory Kumasi Ghana. You did boy Ghana for Tino. Obibiara Uhiambua, and your laboratory in Kwanzaa be a woman be a Pasok Hospital. O Fred Ghana, so your telephone number 0233 3220 81220. Mesa Bosubio 0233 3220 81220. Mesanso Menomo Holland 0650 441 639. Offer me information on the meeting.
And you are there because I'm running up right now. RAYBEN will also be very, very live on our entertainment evaluation show tomorrow at No Limits from 6:30 to 8:30. Check out for RAYBEN. God richly bless you, and we are signing up, and we invite you to join us as we do our evaluation party tomorrow at the No Limits from 6:30 to 8:30. This is Voice of Naija, and we say thank you, RAYBEN, for coming.
I'm so blessed, madam, for having me.
Thank you.
Have a Merry Christmas, you all listeners.
Thank you so much.